So this webinar is going to be about warning signs to look out for when it comes to your reproductive health. So quick rules of engagement. It's being recorded. So if you want to remain anonymous when you ask a question, please ensure that you choose the box to send anonymously. And you're welcome to post questions at any time, but we'll go through them at the end of the talk. Okay, so I'm going to introduce our speaker now because I think many of you do know him, and he is one of our favorites, and he always does favors for us, and he always is so willing to help us with all of our talks. So we do appreciate it. Thank you, Dr. Tato. And I'm going to read this introduction. Dr. Tato Maoto is a reproductive medicine subspecialist, obstetrician and gynecologist. He is a consultant at the Reproductive Endocrinology and Infertility Unit at the Steve Biko Academic Hospital. He is also a keen endoscopic surgeon and works in private practice at Femicare Fertility and Advanced Endoscopic Surgery Center. His passion for teaching goes beyond his teaching reproductive fellows, registrars, medical students at the University of Pretoria. He has also been involved in various education drives across the country and in the SADC region. He is also a member of various societies, including ESRA, SASRIG, and SASOG. So that is my introduction, Dr. Tato. I'm going to stop sharing now. So you are welcome to share your screen.
I'm a bit old school, so I always turn on videos as I was taught so that people can see who's presenting and what we're talking about. So I was asked to speak about reproductive health and the warning signs, which is quite a difficult topic to speak about. And the reason for that being that reproductive health is actually poorly defined and more importantly, poorly understood. Because the WHO has struggled and come up with a definition of what reproductive health is. But I think it's a bit more open-ended than I would like personally. So I'm going to try and focus it, and because it is so vast, reproductive health that is, I touched on just a few highlights. But before we start, I'd like a moment of silence or a moment of prayer for Wafana Wafana before, as they're playing, as I'm speaking to you now. I'm joking about that. I think we'll do well anyway. But the way to think about reproductive health is actually, before we think about that, the WHO defines reproductive health as a state of complete physical, mental, and social well-being, and not merely an absence of disease or infirmity. Now, that is actually the old WHO definition of health in general. But obviously, this now pertains specifically to the reproductive system of both males and females. Now, there's a national guideline that's borrowed that definition, but expanded on it a little bit because there are certain inferences that we need to actually touch on, including, and it infers, for example, a satisfying and safe sex life, also the capability to reproduce and the freedom to decide when and if one wants to reproduce. But before I want to get into that, just to highlight how extensive this reproductive health definition actually should be. I'm going to share two stories that are true stories. One is personal, the other one is from a patient, obviously both anonymous. So I got a call from a good friend of mine in a big panic. And the big panic was that her 13-year-old daughter had been texting WhatsApp with a boy, a 15-year-old boy. And this texting back and forth had actually gotten quite sexual, and nude pictures were exchanged, and there was a plan now to go and have sex. Her response, now this is a very educated person. her response was basically to gyrate the child, to scold the child, and was very firmly. Actually, she herself was hurt about the whole situation. I don't think the child's feelings was actually more secondary. She felt like she failed as a mother more than anything else. That's one scenario, a true scenario. There's a different scenario now of a patient who comes in, brings her 12-year-old daughter for contraception, for the contraceptive talk, which I advise every mother to have, by the way. And I think 12 years is a good age. And unfortunately, I can't show you my slides, but 12 is a good age because the age of sexual debut in South Africa seems to be going down. It's not just South Africa, across the world seems to be going down. So it's better to have that talk before they actually start having sex. So the way to think about reproductive health actually is that it starts in the womb and it ends when we die. Okay, for example, conditions like polycystic ovarian syndrome, the mother actually gives the child or predisposes the child polycystic ovarian syndrome. So if the mother has increased hormones like androgens, the baby in utero then gets exposed to those androgens, and that will also affect the baby's reproductive system. So it means this is a lifelong um, health situation or health problem that the baby will then have. So essentially, it affects everybody at different stages. For example, if and we know that childhood obesity is on the increase in South Africa. If a 5-year-old is obese, I'm trying very hard to be politically correct. I was told not to call people fat, so I'll say with an increased BMI. 5-year-old, childhood obesity, 5-year-old. That baby is predisposed to endocrine abnormalities later on in life. So it means that even before the child actually starts thinking about reproduction as most people think about it, in the sense of wanting to have children, etc., contraceptives, etc. Even before that, there is actually an impact on what we do, and the lifestyle has an impact on the reproductive health. So, I mean, reproductive health is a quagmire. And if you look at the South African guidelines they're called the Sex and Reproductive Health Guidelines, which were published in 2019, and our unit was actually central in actually developing those. And you can see, I mean, it's a booklet. It's basically a booklet dealing with this, and it is a quagmire. There's so many things to touch on, and it involves a lot of stakeholders for it to work. And unfortunately, in South Africa, if we are honest with ourselves, we, reproductively speaking, we're not healthy. It's not just South Africa; it's the whole of sub-Saharan Africa. So with that in mind, and we'll come back to the two patients or the two scenarios that I gave you. With that in mind, the way then to approach this big task, and I've tried very hard to simplify it, is to look at then the human, male and female, during their different stages. Okay, we can start in utero, but for now we will freeze that for now. So we will start pre-pubertal, which means before puberty, and then from puberty to about 45 years, what we call the reproductive years in inverted commas, and then after that, which is perimenopause and postmenopause. And if we take that and we look at certain aspects, one aspect which is important is contraception. Okay, so that's a big important thing. I know people overlook it, but it actually has an impact even on things like your maternal death rate. Because about 25%, and this is WHO data, our data is actually even more than 25%. Our data, the previous Saving Mothers report of 2020 is about 38% of maternal deaths are preventable with early contraception, because those are unwanted pregnancies. And so we look at contraception, then we look at safe conception, we look at the choice of termination of pregnancy, and then we look at prevention of STIs, amongst other things. Okay. Underneath that, we also need to look at preventing certain conditions. For example, in our setting specifically, cervical cancer, breast cancer is a big one. And then there are other issues like post-exposure prophylaxis of STIs, etc., HIV specifically, because that plays an important role. So if we were to divide it just into those sections, then you'll see that it becomes a lot easier, and it becomes a lot more manageable in actually treating this. For example, if we take one topic like preventing cervical cancer, we actually start the prevention of cervical cancer in the pre-pubertal stage, because now there's a vaccine. And so at the age of 12, or between 9 and 12 years old, you can give a vaccine to prevent cervical cancer, which is going to affect perimenopausal and postmenopausal women. Okay, so that is how I want us to start thinking about that. But because I'm a reproductive medicine specialist, I also have to look a little bit into infertility and reproductive health in the reproductive years. And I've actually come up with what I've decided to call the Hateful Eight, only because as a mnemonic, it's actually easier for people to remember. But these are the 8 warning signs of infertility, of fertility issues. Number 1 is painful periods. I know that for women, and a lot of women, and I've had a talk about this previously, where women and young girls think that it is normal to have painful periods. It is not normal to have painful periods. Okay, especially if you need to take any medication for it, or it interferes with your daily life. You're missing school, you're missing work, things like that. Any changes in your menstrual cycle. I can go into great detail about the menstrual cycle because it's so important, especially for the women. A normal menstrual cycle is between, and when I say the cycle, I mean I'm talking the whole cycle.
Maoto, yes. Sorry. Try and share now.
Okay, so The Hateful Eight. It's actually a movie. It's not necessarily a memorable movie, but the phrase still holds water, The Hateful Eight. And we're talking about changes in the menstrual cycle. And I'll go into greater detail because now I can go into the slides of what a normal menstrual period, the menstrual cycle is. Because it's so important to understand that. Sudden or severe acne actually speaks to, and this is specifically for the women, it speaks to hormonal imbalances because it usually means excess androgen somewhere. Significant hair growth and hair loss is similar to the acne, or sudden unexplained weight gain. Also, all of these, okay? Male is also included, so pain or swelling of the testes, changes in sex drive, that's for both sexes, erectile or sexual dysfunction. Erectile dysfunction for the male, sexual dysfunction for the female. This is a normal period, and obviously the illustration is abnormal. So a normal period is between 21 and 35 days. So from the time the day 1 of your period is the day you start menstruating until the last, or until the day before the next time you start menstruating. That time period should be between 21 and 35 days. Actually, best is between 25 and 35 days. And you should, on your heaviest day, use 3 or 4 pads, 3 or 4 or less pads in a 24-hour period. That includes nighttime. You should bleed for 7 days, and you should have minimal to no clots. Minimal to no pain, we've spoken about pain, and you shouldn't bleed in between your cycles. Now, weight is an important thing because for biological reasons, if your BMI, which is a measure of your weight, is abnormal, whether you are too obese or too fat, in inverted commas, or too skinny, then you're going to have problems with fertility and your reproductive health. because actually your adipose cells are actually an endocrine organ in themselves, but also they actually start affecting the body in other ways, other organs. For example, you start producing a lot of insulin, and we'll speak briefly about insulin. Okay. Because insulin, in the past, we used to think, for diabetes, we used to think that the worst thing you could do in diabetes is uncontrolled blood sugar. But of late, increased insulin in your bloodstream is actually being found to be even more detrimental to your health than even the increased blood glucose. So I touched on this, and I'll be brief because contraceptives are so central. This is South African data. This comes from the 2019 South African District Health Survey. And I would suggest you go just look at that. You can see that if you look at the birth registrations in that time period, 10 to 14 years, at the time it was 3,261. The numbers from 2011 are actually higher than this. They're about 5,000, close to 6,000. And you can see 15 to 19, close to 120,000. And in the same survey, you can actually see a trend between the 1999 and 2016 um, comparison in the unmet needs for contraception. So there's actually an increase in the need for contraception compared to the previous past. There's actually one in between, which is about 2003. At that point, we're actually doing much better than 2016. We seem to be doing worse than even at that time. This is from the WHO now, and it showed that 85% of women without contraception, sexually active, are at risk of falling pregnant, and 25% of maternal deaths are actually avoidable with the use of contraception. More scary stats, sorry, with when it comes to sexually transmitted infection prevention. Again, same survey, South African data. 5% of young women between the ages of 15 and 24 reported 2 or more sexual partners. This was in the past 3-month period. So you can imagine 5%, that's a lot. 52%, same age group, reported sex with a partner who is not their spouse or living with them. This is South Africa. 62% of young unmarried women not living with a partner use the condom. So that equates to what? 38% not using a condom. And only 38% of young women, 15 to 19, and 67, 20 to 24, tested for HIV. So you can see, and the data is actually quite scary and unnerving and unsettling. I'm not going to go backwards with the presentation, but I just wanted to just show the problem that we have. It's actually quite a massive problem in South Africa, and to tackle it. And I didn't want to get into the specifics because I just wanted just highlights so that people get an idea that it is actually important to approach this holistically. So I want to go back to those two scenarios, and I hope you will judge me for this, because what ended up happening with those two scenarios, the mother who brought the daughter for contraceptive advice, actually, and I hope we'll have a mini discussion about this, we ended up, this is now the patient and I, because the mother is not my patient, ended up kicking the mother out so that we could have a conversation. And it is important, and this is part of the thing, this is part of the reproductive health, because education is actually more important than all of this. It's empowering. To empower a young girl or a young boy, it actually breeds responsibility for them. So we ended up kicking out the mother, which I think is the right thing to do, but you can judge me for that. Because to have an honest conversation, I think you don't need the parent there, because the parent already has their own. They can be as open-minded as they want to be, but it's different, I think, when it is your own daughter. So we had quite an extensive conversation, and also including STIs, because it turned out that she was actually already sexually active. Um, and there is no way to run away from this fact. And I say this to all the mothers, especially, but also fathers, because they must also take responsibility. It is that we must face reality. It is not, and this now pertains to the other scenario where my friend was very hesitant to face reality in that her 13-year-old daughter was going to have sex. The truth is she's going to have sex. And that's just the truth. And the more you educate them, the more you educate people, the better it is. Because in this day and age, with social media and the information age, actually they know quite a bit, and they just need an open um, somebody, safe space to speak about these kind of things. So thank you. I welcome any questions and any discussions before we go watch Bafana Bafana.
Thank you, Dr. Tata. Thank you, thank you. Okay, so there are a few questions, which I'll go through with you, but I think that you're totally correct. The mother's not your patient, the daughter is. So you need to have those honest conversations with them where they can speak honestly to you. Where did you go? Did you turn your camera off? There you
We
are.
are Saskia. Sorry, I was just blowing my nose, so I didn't want
Oh,
to.
you
You
want
see,
to
now you're embarrassed.
do you want to stop sharing your screen?
Just for a second. Actually, one of the slides that I didn't actually get to because of the mix-up
Yeah, so show
is
it.
the issue
Perfect.
of legality of consent. When is the right age that a woman or a girl child can give consent for any sexual activity? In South Africa, it's actually a bit complicated because the South African law says 16 is the age of consent for any sexual act. Okay, but we say that with a pinch of salt because if, like the example with my friend, the boy's 15 and she's 13, then it's not breaking any law. They're both under the age of 16. The 16 only applies if one person is over the age of 16. That's one.
Okay.
Okay, so that's the one thing. The other thing, and this is in the fine print, is if there's an age gap of more than 2 years. Okay, so let's say the one is 16, the other one is 12. Then there's potentially, unfortunately, it's still a bit ambiguous whether anybody is going to go to jail in that. But that's South African law for you.
Sure.
So it's not as easy as that.
That's so interesting. Do you want to show us that slide? Sure. That's so interesting. I never knew that at all. I just presumed it was under 16, that's
And that's it.
yeah.
Yeah.
And a lot of people
Yes.
do. I mean, I know I'm definitely not the only one. And let's talk about Dr. Tato about this vaping pandemic that we have that all the kids now do. In the old days, you had to really, really want to smoke because it was revolting. I mean, it is revolting. But now with the bubblegum flavors and the water or whatever, it freaks me out completely. My child's 11 and I'm petrified he's going to vape one day and what kind of effect it'll have on his reproductive health.
It's not just vaping, it's these hubblies.
Yeah.
There's vaping and then there's those hubbly bubblies that, oh my goodness, it's just, yeah, the world is gone to a terrible. So the problem with vaping and the hubblies is that most of them actually have nicotine. They have tobacco. I know you did not know that. It comes in different quantities. So the actual thing that they put in the flavor actually has a bit of tobacco in. Now, tobacco is quite, it's a poison actually. That's the way to think about it because it affects different organs, but it also affects the reproductive system. In male, it's more pronounced because it kills sperm. So you end up with a low sperm count. It also affects the movement and it also affects the morphology, which means the way the sperm is. So you get less normal sperm, more abnormal sperm. It has a similar effect on the eggs or on the ovary because it also affects blood supply to the ovary. So you get less quality eggs, and you also get so a woman the way a woman actually ovulates, she has like a cohort, so she recruits eggs a certain number. So that number starts decreasing more the more you smoke. So that's a big problem.
Yeah,
I would not recommend it. Both.
I know. But it's so hard to, I don't know how do you stop them from doing it. It's so easily accessible and it's just
Yeah,
education, right?
very true.
That's what we have to that's what we have to go with. So there are a few questions. Okay, we've got, well, someone's saying it's an amazing conversation, so that's great. What is the earliest age you can treat endometriosis?
That's a good question. I'm glad you brought up endometriosis because we deal a lot with endometriosis. And whew, okay, so let's talk a little bit about endometriosis. The real answer is we should treat endometriosis as soon as we find out that one has endometriosis. We are seeing more and more younger patients with endometriosis because, I mean, with education, people realize that at the age of 13, if my periods are this painful, then it means there's definitely something wrong. But treatment doesn't necessarily mean the more invasive things that we do, like surgery, etc. So we try and avoid surgery in the young girls and the young women. So if you're in your adolescence, we try and treat you medically, which basically means some sort of hormone. Sometimes that might mean a contraceptive pill because it helps with the endometriosis. But then there are also pills that help with the pain. There's second line and third line treatment that has now recently come out, but that we reserve for very severe cases where we're having difficulty with managing these girls. But the simple answer is we treat it as soon as it's diagnosed.
Okay, thank you. There is a question about menstrual or menstruation. It's when I was younger, my menstrual blood was redder. Now I'm older, seems to be browner. Why is that? And I'm going to find out the score for you. Nil nil.
Sorry?
The score looks like it's nil nil,
Oh,
by
it's
the way.
no. Oh, thank you for the update. Thank you. Okay, so the radar thing is actually it's not just about age, it's also about when the cycle you are. In other ways, what day of the cycle you're at. So red blood, the way to think about it, I know that a lot of people think that menstruation is you bleeding the egg. That's not true. What you're bleeding is the lining. So your lining inside of your womb is actually very special because that's where the baby implants. So that lining has to shed. And sometimes it depends where you are. If the lining is thinner, usually when you are younger, the blood is more bright red. The thicker the lining is, the darker the blood, in inverted commas. Also, obviously, it can also be a reflection of the amount of blood you bleed. The thicker your lining, in inverted commas, sometimes the more you bleed because the more you need to get out, okay, or the longer you would bleed. So it has to do with the lining. It's actually quite normal that your menstrual blood is getting darker, especially when you're most fertile in the middle of your reproductive years. It's actually slightly darker.
And how does fitness supplements affect your, especially your sperm health, I would say? So I mean, we know steroids are bad, but what kind of effect does
Very
it
bad.
have on you? Very bad. So you might
So,
look manly, but you're not actually manly. Is that what it is?
so, well, you're not producing any sperm. So the 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 male fitness industry, the big problem is steroids. You're right, and the thing is that a lot of these supplements have precursors to the steroids. So that's how they work. So they'll say, okay, it's not actually a steroid, it's this, but it's a precursor to actually testosterone. Down the line, as you drink it, as your body metabolizes it, then you will get um, um, exogenous steroids, which basically switches off your testes. That's the way to think about it. But then there are also other ones. I mean, your pure supplements, I say pure supplements in inverted commas, creatine monohydrate, whey protein, etc. As long as you take it in the right amounts, doesn't actually have a big impact on the sperm itself. Okay, so it's the other things, it's the add-ons that have problems with it. There are some that amino acids, some pre-workouts that have a hormonal um, um, aspect to it. So anything with hormones, stay away from.
Okay. And I think Michelle's asking this question, because I can tell by the age group. What age should a menopausal woman start looking at HRT?
As soon as she's menopausal. The simple answer is this: HRT is actually it's so important, and a lot of people, especially in South Africa, don't know about hormone replacement therapy. Actually, it's called menopausal hormone therapy now, MHT. But the thing about it is, it because of, you see, in the past, our life expectancy was not so long. So most our great grandmothers used to die at 60. So what if you do the math? That's 10 years or so of being menopausal. Now 80 years. People live 84, 85 years old. Now that's 35 years of being postmenopausal. And we know that hormonal replacement therapy actually has an impact on not just um, well-being, okay, but also on longevity. It actually increases your life expectancy because of the effects of the hormone. But the thing about or menopausal hormonal therapy or HRT is that it also has a cutoff. So usually we say the time you started, so the time you're perimenopausal, so the time around menopause, you start feeling the hot flashes, your menstruation becomes irregular, you start, it's a good idea to start in hormone replacement therapy. And you
Sure.
continue it for 10 years or until the age of 60. There are instances where we push it a little bit, but that's the general rule.
Okay. I feel like we are all having hot flushes today. Whether we
Yeah, these are normal.
perimenopausal, I definitely feel perimenopausal today. Thank you. Thank you, Dr. Carter. There's also a question from a teenage boy or teenage boy's parents. I'm a male teenager and a virgin. How will I know when I'm ready to take the next step? You're going to be a counselor today.
Yeah, I was about to say, I feel like that's a counsel. I'm glad you asked that actually, because that's, to be open is half the battle. And the real truth is, I think it is a personal answer. I don't think anybody here can give you an answer of when you will know when you're ready. But when you know, you know. Usually, I don't want to sound preachy, because usually, we say that with the right person, and when you are committed in a committed relationship, then usually we say you first talk about it, and then you can take that first step together, because it's not up to you. It's a couple decision to make.
Yeah,
So I don't want to be that guy who says wait for marriage, because that one is unrealistic, and I know this.
yeah, it definitely is. And as a mother to a prepubescent boy, and I know Michelle wants to know the answer to this question as well. When do we expect wet dreams to start, Dr. Tato? It's like my nightmare.
On average, around the age of 13, 14, sometimes a bit earlier, sometimes a bit later. But those are normal. Wet dreams are normal. It's your axis, so everybody has a hypothalamic, gonadal, or testicular for the male axis, and for it to get ready, because we as males, you see, we are slightly different, because we produce sperm. We're not born with sperm. So for the machinery to start working, it has to take a few dry runs first.
Is
Pun intended.
that what it is?
That's
So
what
we
it
should.
is.
Okay.
Your hormones starting to work, and the way they know that now it's working, is that, oh, we're producing sperm and semen, and okay, now we're ready to go.
Okay. And then so we should start talking to them about it now. Really.
Oh yes.
Oh,
definitely. The current literature says start at age appropriate, around 8, but obviously age appropriate. And then you work it up so that by the time they're 12 years old, you are having the serious conversation.
Okay. Okay. So they're ready for it then. Okay. Excellent. Are there any other questions? If there are, you've got a minute or so to pop it into the chat. Otherwise, Dr. Tato, thank you so much. And you can go watch the rest of the match now. Thank you for joining us. Even though the boys are playing in the semi-finals, thank you to everyone that joined us as well. Appreciate your patience and your time. Thank you.
Thank you, Saskia, always.
Enjoy the rest
and
of your
thanks for inviting me.
And let's go and win. Go Bafana Bafana.
What's the score? Anyone know?
It was, let me have a look now. Got it. It's still 0-0. Nearly half time. 43 minutes.
Cheers.
Okay.
Bye.
Bye.